hear you.
We can hear you. Can you
now
hear
I
me?
can hear you.
This is
now I can
Walter
hear you.
Gerd. Can you hear me?
Yes, I can hear you now.
Excellent. Good morning and welcome to the 150th anniversary of the Shevchenko Scientific Society. I just wanted to spend just a few seconds to introduce you because Professor Burmester is a giant of rheumatology. He is at the Humboldt University of Berlin and the Charité Hospital, and he's really a man who needs no introduction. He has hundreds and hundreds of publications, is a leading authority in many areas of the world and in many areas of rheumatology. He has taken the lead on an enormous number of clinical trials and made huge contributions to the development of therapeutics in rheumatoid arthritis and systemic lupus. It's a very great pleasure and privilege to welcome you to this highly prestigious meeting, and we look forward to hearing your presentation and telling us what the future holds for therapeutics in the rheumatic diseases. Thank you so much, Gerd.
Oh, thank you very much, Walter, and thank you very much for these very kind words. A warm welcome to you and to the colleagues in the Ukraine. And I looked up when I had my last presentation in the Ukraine, and that was actually in 2021. It was also a virtual presentation, and unfortunately we all know what has happened since. We thought we had overcome Corona, which we haven't quite managed, but quite successfully. But unfortunately, these many very, very terrible things happened, and we tried to help as best as possible, both from the German point of view, but also from the EULAR point of view. And you know that EULAR, where I was a president, is trying to do its also its best to help
Асоціація
patients
ЮЛАР
with
має
rheumatic diseases
і намагається робити
in
все
these
можливе
very, very difficult times.
у ці
And I
тяжкі
will
часи для
now
України.
share my presentation. I hope it's going to work. And the usual question is,
Звичайне
can you see my presentation? I hope you see, because I don't have sound again. So I will just start. Again, thanks a lot. It's a great honor to talk to you from
Велика честь для мене.
But we can't.
Sorry, can you see it? Okay, I will just continue. I hope.
Yes, please continue, Gerd. There was just a momentary
Okay.
interruption.
All right, so I will just continue.
Я буду
Thanks a
продовжувати.
lot, and I will talk about new
Дякую.
trends in rheumatology
Я буду говорити про нові
for
тренди
the
в
next
ревматології
decade.
на
So
наступні
these are my
десятиліття.
disclosures,
Ось ви бачите
and so
мої
the future of
перспективи.
medicine, I think, is
Майбутнє
really,
медицини
despite
дуже
all these problems we are having, especially with the infectious diseases and of course global warming and
незважаючи
war
на
times, I think it's still
потепління
bright. We
і
need
хвороби,
to still be optimistic, because
буде оптимістично.
we have now many means to help our patients, such as let's say electronic health record, which sometimes are a nuisance to us, but they help us in really getting data from many patients, sometimes even millions of patients, to inform us about trends in health. We have mobile health apps which we all use. We have wearable monitors like activity tracks. I'm wearing one since many years. Obviously, artificial intelligence is a very important tool. I will come to that. We have digital therapeutics, and of course, virtual visits will be possible, like video-assisted visits. And of course, we have learned a lot from the Corona crisis here. So let me go into the future a little bit and set the scene. So early diagnosis and early therapy will be crucial in the future. And I would just like to describe a fictitious case in 2030. Laura Lehman is a 44-year-old IT specialist. She has joint pain for 4 months, swollen finger joints, history of psoriasis. And you would say, okay, now she should see a rheumatologist. But indeed, she goes into her living room in the morning and talks to voice machine, and let's call it Alessia. And Alessia says, okay, how can I help you? Where do you have your pains? Are they more pronounced in the morning? Do anti-inflammatories help? Do you have skin symptoms? And so on. And also, there is a little camera on top of her TV screen where Laura is going to have a self-examination, which is actually recorded by the camera, and all the data, both the patient history and the results of the general physical examination, are entered into the system. And of course, she has an activity tracker, and that tells us that she went down from 8,500 to 4,700 steps, and she avoids stairs. However, the cardiovascular system is all right. And she was also recorded that she has small finger joints swollen, and everything is entered into Alessia. Now she should have some blood tests, and even that can be done remotely, because it is done from the fingertips, or there are other devices in the future. It is then dried and is sent even via a drone to the lab, and the results that you can have on the spot already tells us that there is a slight elevation of CRP, but eventually a rheumatoid factor, ACPA, anti-nuclear antibodies, Borrelia antibodies are negative. How is this possible already? And we know that many things are already possible in a virtual clinical video consultation that would also be an offer to the patients. And I use this quite a bit in my daily clinical practice. And of course, we use it a lot in the Corona times. And here is a very nice video by Jack Cush on the right-hand side. There are also other apps that you can put in your symptoms, and like ADA, which I think is available in many countries, and that also helps you to check the symptoms and suggest a certain diagnosis. And you see, I have it on my app here on the back of my, in front of my grandchildren. Well, let's go back to the patient. So the patient is going to a supermarket, and in front of the supermarket, there's this big machine. It is an MRI machine, and that tells us, well, there are erosions in her sacroiliac joints, and so apparently she has a sacroiliitis. And now, while she is shopping, some blood is drawn, and that tells us her macrophage activation profile is weakly positive. She doesn't have evidence of infections, and the proteomics tell us, well, there are some bone and connective tissue parameters weakly positive, but she doesn't have rheumatoid factors or ACPA. The genetics tell us that she's HLA-B27 negative, but she's CW6 positive, and she has some reduced activity of certain cytochromes, so that certain drugs like diclofenac or celecoxib should be avoided and others should be used. So which data do we have in our patients? I mean, I call them big data in parentheses. Obviously, they're derived from only one patient, so it's not truly big data, but it's quite substantial already. So we have the patient history, the examination, we have imaging data. Most of these data are still unstructured. They need to be put into the system in a structured way. But then we have quite a bit of structured data already, like activity tracker data, genetic data, bone parameters, gene expression data, and autoantibodies. And based on all of these findings, so we have imaging, we have the lab data, we have the patient history, we have the investigations of the patients. So the computer calculates that this is, along with the skin data, psoriatic arthritis, and the probability is very high. And there is also an involvement of the sacroiliac joint. So you will realize now that the patient so far has not been seen by a single doctor. Everything was done at home, remotely, or while she was visiting a supermarket. No doctor was involved, and nevertheless, I guess you will also consent that this patient has psoriatic arthritis based on the many findings that I just told you. So this will be a challenge, but also it's an opportunity for us then, if we have a shortage of rheumatologists, which unfortunately will be true in most countries, we can do many things that do not need a doctor, so that the few remaining doctors can really take care of the patients. So now what is happening? The patient is now treated with a combination of biologics and small molecules, and she has a complete remission after 1 year with no further clinical or imaging deterioration, and also a glimpse into the future. Oral medication is delivered or printed directly to the patient's pharmacy via a printing system, which we already know would be possible. There is still a provocative question: will we even see psoriatic arthritis in 10 question mark, of course, years if psoriasis is brought into full remission early on with effective treatment? So let's assume all the dermatologists treat psoriasis very effectively systemically, for instance, with biologics or new orals, so that psoriasis is completely controlled. Will we see less psoriatic arthritis in the future because it's actually prevented? So this is a provocative question which we might ask later on. You may say, okay, this is maybe a lot of science fiction, but let's say self-examination is already possible. We have a program in Germany which we call RheumAcheck, which needs, of course, a little bit of training. We have smart watches where we have the cardiovascular system, even including an ECG. A whole individual genome sequencing is no thing of the future, because we can already do it now. We can analyze macrophage activation profile. And of course, we have now artificial intelligence in form of Elastia, which I called it, or other systems, including, of course, ChatGPT. And you see here on the left-hand side, this is already more than 5 years ago, what was possible in 2017 in terms of wearables that you have all over your body, measuring practically everything, of course, not including the lab data of the blood, but many other things. And we also know that the smartwatches are extremely helpful in informing us about the cardiovascular system, for instance. And also, you can send in already via Amazon your material to have some genetic analysis being done. This is a rather old slide, but within a short period of time, you will find about 330 genes of yourself. So you can already send this in now. And patients even come to these data into my clinic. So what about other disciplines? We can learn a lot. Obviously, in radiology, we will have using artificial intelligence and machine learning, automated reading and evaluation of images. Dermatology already is doing a lot in terms of detection skin tumors via smartphone. Ophthalmology, as you see on the right-hand side, really is extremely advanced in this evaluation of the retina in diabetes or macular degeneration, and increasingly pathology triggered by oncology will investigate the gene expression profile for the planning of the optimal chemotherapy of certain tumors. Here is just an example which was actually published in Nature, where you can use machine learning to discriminate benign lesions from malignant lesions, and that may also be helpful in areas where there is poor access to dermatologists. So we have a big data in medicine. We call it the healthcare disruption. You see the enormous amount of data that we are dealing with, and also the expenditures that will result from all of from using this in the future. This is a slide from 2017 by a colleague from IBM, and of course this has changed a lot in the meantime. How to calculate all this, and so this is a picture of a quantum computer, and just to give you an example, you see that on the right-hand side, certain tasks where a regular advanced system would take some even years to calculate. This could be done within a couple of seconds using these new quantum computers, which are extremely fast. And others are parts of innovation and technology. So let's say a hot glue gun, 3D printers. I already mentioned this also for pharmacy. Being able to electronic skin might be something. Smart prosthesis, a bandage that supplies wounds, and of course artificial intelligence or microneedles for injections without pain. So what can we expect? So we have new medicines in many areas, including, of course, rheumatology. Artificial cartilage might be possible in the future for our field. Obviously, gene therapy may help in monogenetic diseases in rheumatology. And of course, RNA-based therapies. We have the vaccines now, but others will be possible as well. And already we have a bright future, I think, in cell-based therapy, like CAR T cells, effector T cells against tumors and regulatory T cells. And I will end with CAR T cells, which we are doing. So as I speak, a patient in our unit is prepared for CAR T cell treatment to treat refractory lupus in this patient. And you see how this is working. So you remove blood from a patient to get the T cells. They are then altered in the lab, and a chimeric antigen receptor is entered via a vector into these cells. That's why they are called CAR T cells. Then they are grown to millions of CAR T cells. They are then infused into the patient in order to, in this case, to kill cancer cells. But you can also kill B cells, which are altered in lupus, for instance, via CD19. So this not necessarily has to be a cancer cell. It can also be a detrimental B cell in a lupus patient. And you see here, this is the first patient that was published 2 years ago. And you see on the right-hand side how well the patient did clinically in terms of lab parameter and of creatinine. The patient was then without any treatment for years now, and doesn't have any immunosuppressive agents, no glucocorticoids, and it looks like some elements of cure. I mean, cure is not easy to define in rheumatic diseases, but it looks like it, let's say. And then our colleagues from Erlangen included more patients, and you can see here in this recent publication that also in more patients this worked very well. You see it on the upper left-hand panel with the SLEDAI, which came back to normal in these patients. Interestingly, B cells returned after treatment, so that maybe the immune system, which is then developing, is a normal system again. So we have a bright past and a bright future, I think, in rheumatology. Not even listing the cellular treatment on that slide, but you see here, we started with NSAIDs and gold salts, then went to glucocorticoids, to methotrexate. Then we had, of course, the major development of the biologics, and subsequently the small oral molecules, which help us a lot as well. So you see, these are two milestones along with the cellular treatment that I mentioned. Finally, some words to ChatGPT, how that may help us. And I have just give you an example how, in parentheses, this system can be creative. And it was introduced actually only a year ago, ChatGPT, and has really already changed the world. And here's a question which I retrieved from the website of the developer. So you ask ChatGPT, tell me about when Christopher Columbus came to the US in 2015. And of course, ChatGPT says, well, this is tricky because Christopher Columbus died in 1506, so he could not have come to the US in 2015. I think everyone knows, okay, this is a decent answer any computer could give. But now, see how this is then proceeded. Now ChatGPT, and this is just a computer system, says, but let's pretend for a moment that he did. So there are some elements of creativity here. So if Columbus arrived in the United States in 2015, he would very be likely be surprised how the new world has changed since 1492. You would see that the country was no longer inhabited by Native Americans, but more like by a multicultural nation with people from all over the world. You would be amazed to see the advances in technologies from skyscrapers to smartphone. And lastly, he might be surprised to find out that many people don't view him as a hero anymore. In fact, some people argue that he was a brutal conqueror who enslaved and killed native people. So all in all, it would be a very different experience for Columbus than the one he had over 500 years ago. And this actually was not written by a human being. It was written by ChatGPT, which I think is quite remarkable here. So I think we have a very interesting future ahead, and I'm optimistic, a bright future ahead of us in the means that we have to conquer diseases. And so some elements of Star Wars, like robots and artificial skin and so on, are already implemented nowadays in our daily clinical work. And so with these words, I am truly honored to give this presentation at your 150th anniversary. So a very, very long tradition. I wish you all the best, and we hope very, very much for peace in the near future. So thank you very much for your attention.
Wonderfully positive vision for the future of our subspecialty. I was wondering if I might ask you one question and follow up to some of your comments. I think you painted a very interesting picture of how we might use a considerable amount of data from different sources to help us to arrive at diagnostic evaluations of our patients. And then you expressed the reservation that it may be a challenge, in fact, to manage some of the problems because of the shortage of rheumatologists. And some problems are simply going to be very difficult to deal with, particularly in regards to degenerative disorders, for example. So do you think that the future of rheumatology might also, particularly through artificial intelligence, also include the capacity to help us to manage patients, to provide appropriate advice to patients, and to provide roadmaps for appropriate treatment of patients? What are your thoughts about that?
Absolutely. And I think artificial intelligence can help us a lot there. So already, I mean, ChatGPT, we all know, has its glitches. It has sometimes there are hallucinations and wrong answers. It doesn't correctly cite the references and so on. But still, it helps us a lot. So it would be great. Let's say a patient has certain pains and certain problems, enters them, and of course, we know that then maybe early treatment might be possible, so that we can avoid a lot of damage, because the patients will be seen then, if they are really have a significant disease, very early on by the, let's say, few remaining rheumatologists, so that we avoid damage and therefore avoid morbidities in the future. So I think that will be very helpful, and increasingly our patients use not so much ChatGPT, but let's say Google and other tools in order to be informed very early on about their disease. And of course, then to give guidance how to manage your disease will be very important using these means. And of course, we all know that apps on our smartphones may be very helpful, because they alert us, well, you haven't really have your exercise today. You need to have more exercise today. And that, I think, is really a very helpful motivation, at least for me, in order to do the exercise. They remind us to take the pills regularly at the times requested. they remind us to go to the physical therapist and not forget the appointment. So I think there will be a lot of opportunities which are already available now, and in the future it will be even, I think, brighter, in order to have our daily plan if you are a patient and very sick, for instance, in the beginning, what to do and how to avoid damage. I think that will be very, very, very interesting, and I think possible.
Yes, I already have patients who come to see me having checked with Chat GPT, telling me what the diagnosis is. I also just wanted to end by assuring you, Ukrainian rheumatologists are going to want to put a lot of effort and make a big contribution to the future of global rheumatology. Thank you so much, Gerd. It's wonderful to have you give such an enormously positive view of the future, and a great way to start off our very busy day at this symposium. All the best to you. Thank you. Merry Christmas to you.
All the best to you as well. Thanks a lot.
Bye-bye.
Bye-bye. Thank you.